The following case study contains information that will be assessed and developed into a nursing care plan by first-year nursing students. After listening to the case study, you may continue on with parts 1 through 4, which contain class meetings conducted by Associate Professor of Nursing, Lori Cerone.
Mr. George Smith is a 75-year-old man admitted to Elder Years Extended Care Facility after suffering a left cerebrovascular accident. Prior to admission, Mr. Smith was functioning independently, living in a 2-story house with his wife of 53 years. Mr. Smith has 3 children and 7 grandchildren living nearby. Mr. Smith and his wife enjoyed an active lifestyle. They played golf twice a week and square danced at the local senior center on the weekends. Mr. Smith has been admitted for short-term rehabilitation in the extended care facility, located 20 miles from his family home. Mrs. Smith visits the facility daily and would like him to be moved to a facility closer to home. He's on the waiting list at Morningstar Rehabilitation Hospital. Mr. Smith has a past medical history of coronary artery disease with an angioplasty in 1990, hypertension, insulin-dependent diabetes mellitus, and a colonoscopy laser excision of polyps in 1998. He also smoked 2 packs of cigarettes per day times 25 years. Mr. Smith presently has right-sided weakness. He has a custom-made splint which is placed on his right hand and forearm for 12 hours a day. He also has a splint on his right leg and foot which is placed when he's out of bed. He spends the majority of his day in his wheelchair. Mr. Smith's right arm is placed in a sling when he's out of bed. Physical therapy is ordered daily. Occupational therapy will see the patient every day for assistance with independence in activities of daily living. He requires moderate assistance with care and ambulation. He has recently advanced to ambulating 100 feet with a quad cane and assist of 1 person. Mr. Smith's sacral area and left elbow have recently become reddened, and he has several small open areas on his left forearms. Tegaderm has been applied. Socially, Mr. Smith is encouraged to participate in activities available in the facility, but remains on the periphery at this time. During hospitalization, Mr. Smith suffered from aspiration pneumonia. A subsequent swallowing study revealed the need for thickened liquids. He continues to require oxygen at 2 liters via a nasal cannula. Mr. Smith tolerates an 1,800-calorie, low-sodium, low-cholesterol diet and thickened liquids to an applesauce consistency. Mr. Smith moves his bowels every 3 days with the assistance of medication. Mr. Smith is incontinent of urine occasionally at night when his urinal is not at his side.
This concludes the case study. Use your notes gathered from this case study to follow along in parts 1 through 4 and develop your own nursing care plan.